You're good
Good
to
to
go.
go, Brittany?
All good. Thank you.
All right, thank you. Good morning, everyone. It is 10 o'clock. We'll call this Long-Term Care Committee of Management meeting to order for March the 19th. We have a lengthy agenda, so I'll just remind the elected officials of your obligation to declare an interest. Seeing nothing, if anything should arise, you may declare it at that time. Our first item up for discussion is the report LTCR CM 04-26 regarding the long-term care director update be received for information. Can I have a mover for that, please? Moved by Member Patterson and seconded by Member Keaveney. And we will turn it over to you, Jen. Good morning.
Great, thank you. Good morning, Mr. Chair, and good morning, committee. Before I get into the report, I would just like to formally welcome and introduce Kim Mustard to the meeting and to the team in her official role as Executive Director for Grey Gables. So welcome, Kim. And
thank you. I appreciate that. Thank you, everyone.
Welcome, Kim. Congratulations on your new appointment. And on behalf of the Committee of Management, we look forward to your leadership and working with you through this process. Thank you.
Oh, thank you for those kind words. I really appreciate that. And thanks for having me today.
All right, thank you. I'm just going to pull my notes in front of me. So someone, Chair, you may need to speak up if someone has a question because I might not see you all.
I'll keep an eye on them, Jen.
All right, thank you. So this is the director's update for the period of January 1st to February 28th. And as always, it was not a slow couple of months. So I'll get right into it. In December, this is very exciting, and you'll hear about this a couple of times throughout this meeting. But in December, Grey County was notified that Lee Manor was selected as one of 17 long-term care homes in the province to receive the funding through the Improving Dementia Care Program. And it's 17 homes out of over 600. There were over 100 proposals submitted. And so this is really a big deal and really exciting, and recognition that reflects, it's really acknowledgement that our Color It Your Way approach is an emotion-based model of care. And just some more details about the 17 homes. So there's 17 homes, and of those 17 homes, 5 models of care or programs were being endorsed by the ministry. 3 of them are kind of mainstream trademarked programs, such as Butterfly, Dementiability, Eden Alternative. And the other 2 programs were Grey County's Color It Your Way, and Durham Region has a homegrown model that they've established, and that was endorsed as well. So this is really exciting news and a really big deal. And I know we've talked about it before, but I don't want to miss an opportunity to recognize the team at Lee Manor under Tolleen's leadership in really moving this program forward and being pioneers in person-centered, emotion-based care in the province of Ontario. So very exciting. The Ministry of Health and Ontario Medical Association have agreed on compensation increases for physicians, which includes the Physician on Call program. So this is welcome news, and there's more information embedded in the report. Advantage Ontario in February submitted their pre-budget submission, and as an advocacy tool for the sector, for the province to consider. And just 2 areas that I want to highlight. It focuses on expanding support for seniors, assisted living, and home and community care. So members of Advantage, there are, over half are long-term care operators. The other half are also operate services for seniors across the spectrum. And so there's some extended advocacy in kind of working upstream to support seniors to live the lives they want to in their homes and community, and as well as advocating to ensure that long-term care homes are properly resourced to meet the rising resident acuity. So this pre-budget submission supports the whole spectrum of senior services. The ministry also advised long-term care homes of its transition to Transfer Payment Ontario as a centralized government-wide digital platform for managing transfer payments. This initiative supports the modernization and standardization of the process. And it is mandatory that all long-term care homes get involved in this and up to speed. And so the long-term care office coordinators are working with our county finance department to complete the onboarding, and we're not expecting any disruption in funding. Also just want to note that the annual long-term care home service accountability agreement, our LSAWS, declaration of compliance requirements were reviewed by the executive directors and have been signed back to Ontario Health. We did have a pre-recorded family meeting in mid-March, and our first quarterly meeting of 2026, and we included updates for anyone who chooses to listen about ministry announcements, including our IDCP program, the dementia program, as well as an overview of the 2025 annual report for the long-term care division and the 2025 BSTU report. Infection prevention and control. In mid-January, respiratory illness activity in the community started to decline, and so we were able to discontinue the home-wide universal masking at Grey Gables and Lee Manor in mid-January, and then the following week at Rockwood Terrace. We still always make sure that masks are available at the entrances for when people are coming and going, and we continue to encourage people to not visit when they're not well. And that process of kind of turning up the dial and turning down the dial during respiratory season has been serving us well. 6 years after the pandemic, the COVAX Ontario system to manage COVID vaccines is being discontinued and transitioning to a provincial system in April. Between March 31st and when that system is up and running, we are required to manually document our COVID vaccines that we're giving during that time. Staffing and training. A number of initiatives, well, 3 that I want to highlight that the province has introduced. Jumpstart opportunities in nursing, so Join LTC, provides financial incentives for nurses who commit to working in long-term care for 24 months, including up to $25,000 for full-time, half of that for part-time, and additional rural and remote incentives. Nursing Partnership, which is the Nursing Pledge program, supports clinical mentorship by providing funding for dedicated nurse mentors within each home, and the Nursing Student Extern Pilot program. And I have to be honest, I had to look up what the difference is between an extern and an intern, and I'm not sure I know that still. But it's an initiative to place nursing students in select long-term care homes to strengthen the future nursing workforce and support care delivery. And so what I did take away is that this is an intentional, concerted effort to have experience in long-term care as part of the student education, the registered nursing education program. And while that does happen, there hasn't been this concerted effort to have more individuals that are training to be nurses have experience in long-term care. The goal by the province is to attract around nearly 4,000 nurses into the sector and to build professional development for existing staff. Grey County, our 3 homes have registered for the Nursing Pledge program, and this program is similar to the PrEP LTC program, which we call our Color It Coach program, and we've done a lot of work with the Center for Learning, Innovation, and Research in building the PrEP LTC program and providing documents and tools for other organizations wanting to do the same. And we're in the early stages. CLRI has reached out to see if we might have some team members interested in helping build similar tools for the Nursing Pledge program. So we are participating in the program and also helping to build the tools for long-term care for other organizations. So that was a nice email to receive the other day. Wellness always continues to be a focus for our team members' experience. And so the first quarter of the wellness newsletter was released during this period of time. Accreditation is an ongoing journey. So what we've done so far this year is completed the Global Workforce Survey. Those results, along with the Corporate Employee Experience Survey, will be analyzed to develop action plans for improvement. The other thing that we started doing in preparation for accreditation when we did our initial survey was to develop an annual report. And embedded in this report is the 2025 Long-Term Care Annual Report, as well as the 2025 Behavioral Support Annual Report. And I'm so glad that we do this work because it gives us a chance to pull together and do a reflection of all of the amazing work, progress, education, initiatives that we've been a part of the year before. And often we're busy, and so we just get working on our next project and our next initiative, and we don't take a few minutes to do a reflection. And it's pretty impressive stuff. So if you have a minute to scroll through the 2025 annual reports, I encourage you to do so. And they're embedded in the document. And that is my report, Mr. Chair, and happy to take any questions.
Thanks very much, Jen. Always lots going on. Questions from committee members? Jen, Chair does have one question. You mentioned there's it was either 5 or 6 different dementia programs that are being piloted. Is there going to be an evaluation of those to find best in class? And is there much difference between the various programs?
That's an excellent question. Thank you, Mr. Chair. I might defer to Talmeen, who's been doing a lot of research and work in this. There will absolutely be an evaluation process, not necessarily to determine best in class. The program that we are doing is, we're calling it BSO Plus, and it includes bits and pieces of training from some of those other programs like Dementiability, BSO pieces, You First, Gentle Persuasive Approach, and TIPA SNOW. And TIPA SNOW is an American occupational therapist who has become an expert and done a great deal of work in the space of dementia care over the years. And for a number of years, we've been using her education and her approaches. And so we're bundling all of those together with Color It Your Way as the foundation that ties it all together. Some operators and some of the 17 homes are starting with Dementiability, for example. So the funding that they've received allows them to train a number of staff in the Dementiability education and practices. The province is saying that there's a number of ways to do emotion-based care, and it's still evolving in how that's even going to be measured. I think through compliance and quality measurements, it's difficult to measure quality of life, how to have a measurable indicator on what is quality of life. But they're all underpinned by similar philosophy of, it's not cookie cutter, it's based on the resident experience, it's emotion first, connection first, and followed by task. And I'll maybe, if it's okay with you, Mr. Chair, I'll see if Tolleen has anything that she'd like to add.
No, absolutely. Morning, Colleen.
Good morning through you, Chair Mackey. Sorry, I think, Jen, I think you summarized it really well. I do think that the ministry is looking for what is out there, different processes. I don't think it's that there is one solution. And it's about how do we do the best job we can for folks that are suffering from this disease. And there's more than one way to do it. But it is all about focusing on the person in front of us versus the tasks that get laid out through legislation. So I think it's really a wonderful movement forward from the ministry's perspective to recognize that it's not just about a series of safety issues that we have to look after.
Thank you very much. Good morning, Warden. I see your hand up. Go ahead, please.
Good morning, Chair. I just wanted to add that yesterday, Director Cornell, along with Director Shaw and myself, did the taping for Politically Speaking. And she spoke about, Director Cornell spoke beautifully about these programs and about what we're doing and how our Made in Gray solutions is something that is going to benefit others as well. So if members of the communities that you're in are interested in finding out more about that, I would encourage them to look up that episode and be able to hear further in depth about what it means for our residents here in Grey County. Thank you.
Thank you very much. We'll have to watch that. We're always leading the way in Grey County long-term care. All right, if there's no other questions, I'll call the question. All in favor of receiving the report? And that is carried. Thank you. Next is the LTCRCM 05-26 regarding the long-term care operational report dated the December 15th, 2025 to February 14th, 2026, be received for information. Have a mover, please. Member Hutchinson and Member Carlton, and we'll turn it over. First on the list is Dana. Good morning, Dana.
Good morning. Excuse me. Good morning, and through you, Mr. Chair. I'm going to provide a brief quality and clinical update for the committee. You'll see by the note in the report regarding InterRide that the next report will be brought forward to the May meeting. I can tell you we've all successfully rolled out that change management approach and are working through the details, and the teams are getting really comfortable with the new approach. But we will bring forward in May the focus on the Q4 indicators and overall trends to support the ongoing quality improvement efforts across the homes. I also wanted to provide you with an update on resident immunizations. During the 2025 respiratory season, 2025-2026, it spreads itself through, but we implemented our annual influenza campaign. We also continued with our ongoing COVID vaccinations, and we supported the rollout of the publicly funded RSV vaccine, along with administering ongoing recommended immunizations such as pneumococcal, tetanus, the list that we try to maintain for all the recommended vaccines. We offered these vaccines to all eligible residents with our informed consent obtained in line with our policy and public health guidance in terms of who's eligible and timing. Influenza, COVID, and RSV vaccine rates up to December 31st are required to be reported annually to public health. So I did provide in your report the data up to December 31st, but I can advise that those rates are much higher to date, as ensuring vaccines are up to date is an ongoing activity of the homes, and vaccines continue to be offered to support residents who newly move in or become eligible later in the season. For example, just the timing of their COVID vaccine, or if they did have a recent infection, we do delay, but that is an ongoing assessment. And we also may provide those who may have initially declined, perhaps just variables in terms of changing their mind or situations and circumstances change. So we continue to maintain that vaccine. And overall, our resident vaccine program supports resident safety, reduces the risk of severe respiratory illness, and ensures that we are aligning with our ministry requirements and our IPAC expectations. Any questions?
Any questions for Dana from committee members? I'm not seeing any, Dana. Thank you very much for that update.
Thank you.
We will now move on to Karen. Good morning, Karen, for operational readiness.
Good morning, and thank you, Chair Mackey. Yeah, things are moving along at the construction site. Just a little update from the completed work there that I've noted is that they plan to have the east wing watertight by Monday in preparation for the top pour cement flooring in that area, which is slated to occur on Monday. So that's good news. We always get very excited when we arrive to work and can smell tar because that means they're working on the roof. So we're happy that there's a deadline and that will be completed. There is still a portion of the roof after that over the center core area. But getting that east wing watertight means the trades can get in there and do their drywall and all those kinds of things. So we're excited about that. We are currently awaiting a response from the ministry regarding our initial pre-occupancy report. They said it could take up to 20 days, and that date is coming tomorrow, so we'll see. But waiting nevertheless. Just a little update regarding the schedule for the building. We are currently awaiting an updated schedule. We're promised that it would be released with minutes from a meeting held on Tuesday. So that will give us an update there and allow us to determine if there will be any delays or if we need to move our move date forward or back, I guess is the correct term. So that's the news from the new building, and happy to take any questions.
Thank you, Karen. Any questions from committee members? Just in regards to, Jen, when we had the meeting with the minister around transitioning our residents from the old Rockwood to the new one, any feedback from the ministry yet on, I guess, giving us a little more time to do that transition?
Through you, Mr. Chair, I don't think we've received anything yet. Deputy CAO Niall, have you heard anything? Okay, so we'll do a little nudge. I think it's a good opportunity to do so.
Thank you. All right, not seeing any other questions for Karen. Thank you for that update. Exciting to hear things are moving ahead. We will now go on to Kim and the Grey Gables Ministry Inspection update. Morning, Kim.
Thank you, Chair Mackey. The Ministry of Health, Ministry of Long-Term Care inspectors were at Grey Gables December 11th, and then again from the 15th to the 18th. This inspection was focused on medication administration. A written notification and order were left for the home around medication management and the orientation process for registered staff. We quickly implemented an action plan that included bringing into the home an experienced nurse from a sister home to help create a more robust orientation and an auditing structure for our nursing team. This has since been cleared by the Ministry of Health in their January visit, and that'll be in the report in our next Committee of Management meeting. Does anybody have any questions about that?
Thank you, Kim. I'm not seeing any questions. All right, we'll go on to Terry in regard to the Rockwood Terrace Ministry inspection. Morning, Terry.
Good morning. Good morning, and through you, Mr. Chair. A ministry inspection was conducted on site at Rockwood Terrace between January 21st and 22nd, the 24th to the 29th, and they also did an off-site review due to weather, January 23rd and 27th. During this inspection, our previously issued compliance order, which was related to ensuring care is being done as per care plan, was put back into compliance. The inspection also resulted in 4 written notifications of non-compliance. 2 were duty to protect. 1 was a reporting requirement as staff didn't immediately report suspected abuse. And the 4th and last written notification was around infection prevention and control. And specifically, they outlined that during an outbreak, there was insufficient evidence to demonstrate that 3 residents with symptoms of infection were monitored or assessed every shift while in isolation in accordance with protocol. So an action plan was quickly developed, actually before they even left the building, and for follow-up on these findings, and the corrective actions are in place. Does anybody have any questions?
Thank you, Terry. Any questions, committee members? Thank you, Terry, for that update. And we will now move on to Tolene.
Good morning, committee, and through you, excuse me, through you, Chair Mackey. Sorry, I apologize for my croaky voice. I'm about week 5, I think, for this cough, so my apologies. I'm trying hard not to cough today. So thank you very much. Lee Manor had an inspection that was reported on at the last report. There'll be another report in the next report for a recent inspection. But I wanted to just quickly chat about the critical incident summary that we have included in the report, as we always do. So a couple of things I wanted to just remind committee and reiterate. Critical incidents is part of our legislative requirements. We have to report to the ministry under certain criteria for each of those categories that are listed in the chart. Abuse, neglect, and improper care or treatment are very stringently monitored by the ministry. We have to report those allegations very quickly before we've even done an investigation, and then we report back to the ministry. So I like to highlight that 13 items that are showing there doesn't necessarily mean there were 13 negative things that happened, because we haven't had an investigation yet. Often they're resident to resident, so most of those are resident to resident, and I believe all of them have been inspected and reviewed by the ministry at this juncture. And so any areas of concern or non-compliance would be seen through our ministry inspection reports that we just previously reported. The other thing I wanted to highlight around that, which we don't talk about, these are, sort of negative things, but I always like to talk about how wonderful the staff are at preventing these things in the first place. So while we see, 10 allegations, there's 100 that were prevented, resident to resident situations that, I'll walk on the floor and I see a PSW go, and they don't even know they're doing it. They're so good at their job that they can intervene and prevent a situation from occurring at all. And that's something we can't measure. Like, we don't even know it's happened, right? So I do like to highlight that those positive things really happen a lot and aren't necessarily reflected in these kinds of reports. The other thing, if you don't mind, I wanted to, because we don't see it very often, is to talk about the environmental hazard. So we don't see a report for that category very often. And to just share with you, in this particular scenario, that was Lee Manor, and it was one call bell that didn't work. And so under the regulations, we have to report that to the ministry. There's a number of strategies we have to put in place to make sure we're addressing that risk. When it occurred, we discovered one call bell wasn't working. The maintenance team immediately tested, and these things never happen during business hours, so it always seems to be after hours. And the maintenance team immediately runs around the building and checks every single call bell to make sure that we know what the status of the risk is. And then we have to make sure if all the call bells were affected, we would have to have a monitoring system, someone circulating on each floor, checking on residents like every 15-20 minutes to make sure nobody needs help, that kind of thing. In this scenario, it was only one call bell, and obviously we look after that particular resident with increased safety checks and follow up, obviously, to fix the problem. But we still have to report that to the ministry. So I just thought it was interesting to highlight that particular item as well, if that's okay. And then I believe I was to give sort of a bit of a verbal update on the IDCP as well. Did anyone have any questions about the critical incident stuff before I ask if it's okay if I give that verbal update?
Tolene, thank you for pointing out all the prevention that's happening. We certainly recognize the interpersonal relationships that our staff have with the residents, and it's important to note all the positive things that are going on. So we appreciate that. Any questions from committee members? Not seeing any, Tolene, so you can continue on.
Okay, thank you very much. Again, I just wanted to very quickly, so I have to bring it up from my screen here, very quickly just highlight again related to the IDCP. So the Improving Dementia Care Program from the Ministry, we're calling it Color It Your Way, an emotion-based care framework from philosophy to practice. That's kind of our name for our program. And I did want to just share with committee that we did have the province wanted to do sort of a second announcement with across the home. So our local MP, Paul Vickers, visited the home with the parliamentary, I can never say that word, assistant Don Gallagher Murphy. I want to make sure I got the name right. A couple of weeks ago. I'm sorry, I've forgotten the date already. Is that awful? Anyway, whatever date it was. So they were here last week and visited the home. As the stars aligned so beautifully that we were actually doing some of the training that day over in the auditorium at the Sydenham campus. So they came to Lee Manor, made their announcement, toured the home a little bit, got to interact with residents. It was wonderful. And then went over to Sydenham campus and got to engage with the staff who were doing the training and really spent quite a few minutes over there chatting with everyone. It was really engaging and gratifying, and it felt really good for the team for sure. So I just wanted to share that we had that visit, and thank you to the team who supported them coming, County Council and Deputy CAO and the CAO and the Deputy Warden, my apologies. Sorry, I got my words mixed up. And really, really appreciate that we had that opportunity to engage. So thank you.
Thank you, Tolly. Questions from committee members? Well, it's really exciting that this program is being rolled out and, the extra funding for Lee Manor. Just wondering, Jen or Tolleen, is there any plans, even though there's not funding, to roll some of this out into our other homes?
Thank you for that question. I'm so glad you asked. Yes, our plan is to change the world, Mr. Chair.
Wow.
So we'll start with Grey Gables and Rockwood Terrace, but part of our commitment in our proposal was to demonstrate that an operator who maybe doesn't have the funds to implement fully the Butterfly or Dementiability or some of those programs that are there, and they've led the way in this work, absolutely. But they can be costly to implement and sustain. And so part of our proposal was to demonstrate that you can have an emotion-based model of care based on a vision and taking bits and pieces of education, which we, of course, there's a cost, and be able to implement that in your long-term care home. And so part of our commitment was that we would share those resources and tools. Internally, we are working to embed the education and training that we're doing right now at Lee Manor in the education that's required as part of the transition from the existing Rockwood to the new build. So there's opportunity. There's already a requirement to do orientation and training for all staff. And so we're building this into that education so it becomes embedded. And we will find a way to implement it fully at Grey Gables, although Grey Gables is already down the path in this with the work that they've done with the Behavioral Support Transition Unit. So a number of team members at Grey Gables have already had a lot of the education that we are making sure everyone is getting at Lee Manor. So we're well on the way in all three of the homes and on our journey to change the world.
I knew that would be the answer, Jen, so thank you for confirming. All right, we'll move on to Kim is going to give us an overview of the event summaries. Back to you, Kim.
Thank you, Chair Mackey. This report captures the warm, lively spirit that filled our home during the Christmas season. All three homes hosted a variety of festive events or activities, and there was no shortage of laughter or holiday cheer. The Christmas sweater days and the pajama days, community choirs and light tours all brought joy to the residents and the staff. As we stepped into the new year, the fun did not stop. Residents stayed cozy indoors with entertainment, book clubs, and a wide variety of engaging programs. Rockwood Terrace hosted a cruise themed week, giving everyone a bright and sunny escape during the middle of winter. Valentine's Day is always a great backdrop for events, and Grey Gables hosted a sweetheart luncheon. And the 2026 Olympic Winter Games was a definite highlight for the residents at Lee Manor. So it's been a busy season for all the 3 homes.
Thank you, Kim. Always exciting things going on for the residents. Any questions for Kim? All right, we'll move on to Terry and the Color It stories.
Thank you, and through you, Chair Mackey. The Color It story I'm highlighting is from Lee Manor and demonstrates how the Color It philosophy is lived through everyday meaningful experience in long-term care. A resident expressed a wish to host their own book club, and the interdisciplinary team at Lee Manor worked collaboratively to support her choice and independence. To ensure she could fully enjoy the experience, an early lunch was arranged. The family dining room was decorated with a Valentine's Day theme, and the table was set to create a warm, welcoming social environment. Recreation team members supported the event by serving refreshments and assisting the resident as she hosted and welcomed her guests. Moments and programs such as this foster social connection, encourage new relationships, and reinforce that choice, dignity, and belonging are integral to the daily life at all 3 of our Grey County long-term care homes, not just for special events, but as a part of normal everyday living.
Thank you. Is there any questions from committee members on the overall operational report? All right, we'll call a question. All in favor of receiving it? That is carried. Thank you. Next, we have LTCR CM 06-24 titled the 2025 Long-Term Care Write-Offs of Uncollectible Accounts be received. So this isn't as exciting, but we'll turn it over to Marcus. Good morning, Marcus.
Good morning. Sorry, Chair. Could we just get a mover and seconder for that?
Absolutely. Sorry.
Thank you so much.
Thank you, Brittany. Moved by Member Nielsen and seconded by Member Carlton. Now, Marcus, you may go ahead.
Thank you, Mr. Chair. Unfortunately, I wasn't consulted on the agenda line, so it's not great for me to go after warm and lively and colored reports and then say, and now let's talk about legislative accounts receivable. Still a good news report for the committee. Just again, as the high level, as obviously we talk about this every single year, but it is a legislative required report just to basically put onto our books if we have any accounts receivables, mainly in the resident revenue world for the accommodations, that if we are saying that they are uncollectible or that we can't receive them, we are eligible to receive 50% of that, of the basic portion of those resident revenues back from the ministry. We obviously need to do this report on an annual basis, but we are in, again, a good news situation here that we are reporting 0 bad debt recovery or write-offs required for 2025. Again, this comes largely onto the cap of Kelly Litt, Stacey Young, and Aaron Brick, our office coordinators, because they're the ones who communicate and are connected with their homes. And so while this isn't us saying that we have 0 accounts receivable, those who are in arrears all have payment plans or are on some sort of format that we can see that we are going to be made whole on our payments and that kind of stuff in a reasonable time frame. So again, these cases do come up. However, the coordinators have been great to work with the families and with the actual residents themselves, and there's none that we're poised to say there's no chance for us to get it or that we're at risk of not receiving. That's the high level of it. Again, the rest of it stands as it does legislatively in that, but I'm happy to take any questions about it.
Thank you, Marcus. Certainly, that's good news. Jen, I see your hand. Go ahead, please.
Thank you, and thanks, Marcus. It is an exciting report. I'll also, and thank you for the shout out for the office coordinators. And I'll also just add for committee that the introduction of our two full-time social workers across the 3 homes as Grey County employees also plays a big role in this work. The social workers work really closely with the office coordinators and the residents and their families to set up those plans to help make sure they have their income tax done, to make sure they're receiving the different funds that are available to them, or more complex situations and helping sort out the complexities that come with families and finances and some of those difficulties when someone maybe has been living with their family for a number of years and now they're moving into long-term care. Their accounts may have been entangled, and there can be lots of dynamics and challenges there, and our social workers are playing a lead role in supporting that work as well.
Thank you, Jen. Any questions for Marcus's report? All right, we'll call the question. All in favor? And that is carried. Thank you. Next is LTCRCM 07-26, nurse call replacement system for Grey Gables and Lee Manor be received, and that staff be directed to revise the budget to an upset limit of $300,000 for Grey Gables and $595,000 for Lee Manor for the nurse call replacement system, and that the funding for the 2026 capital projects GG 019 parking lot replacement of $490,000 and LL 041 replacement of the air makeup system $424,000 be used in order to fund the nurse call replacement system, and that staff be directed to proceed with the request for proposals for the nurse call replacement system for Grey Gables and Lee Manor, with the results to be reported back for approval. Can I have a mover for that one, please? Moved by Member Hutchison and seconded by Member Patterson. Good morning, Deputy CEO. I'll turn the floor over to you for this one.
Good morning, Chair Mackey, members of committee. Thank you very much. And if Marcus had a difficult one to follow and brought financial information, I'm bringing financial information which is slightly less positive and good news in terms of this one. And I get to kick off the back end of the agenda, which deals with some financial issues. I will lean on the team to support me when it comes to any technical questions around the systems and what the systems do and don't do. But for a high-level introduction, we're talking about the nurse call system. And as Talene mentioned a little bit earlier, these are a critical part, in fact, legislated part of our long-term care facilities and homes. And they're the ability to be able to raise for assistance when it's needed. The systems operate in a number of different ways, from touch buttons and pull cords to sensors, which are mounted in and around beds to alert staff if patients get out of bed at unexpected times of day or night. And so the nurse call system is a critical piece of the resident safety within our long-term care homes. We have 3 systems in place at the minute: Rockwood Terrace, at Lee Manor, and at Grey Gables. The Rockwood Terrace system is obviously being replaced as part of the Rockwood scope of works, and so there'll be a new system embedded within the Rockwood Terrace contract. That's part of the contract piece that's going through right now, and so that will be installed in the new Rockwood Terrace. The systems in Lee Manor and Grey Gables are increasingly old. They're both over a decade old now, and are starting to show signs of their age, not simply, in fact, of the systems themselves becoming a little bit older, but the technology that the systems rely on is increasingly becoming outdated. And there are new and exciting innovations within the nurse call sphere, which can add improvements to resident safety and well-being. And so the time has come to replace these systems. This was considered through the long-term capital planning at each home, and each home has $150,000 allocated this year from reserve financing to support the capital purchase of new nurse call systems. As we got closer to this year, we started reaching out to look at how we were going to replace it. There was an initial concept that we wrap all 3 homes into a single procurement, and we purchase the Rockwood Terrace, the new Rockwood Terrace system, and the additional 2 systems all at the same time, so that all 3 homes are operating on the same technology platform and the same system, which allows for what we anticipate to be an order of magnitude saving by buying for 3 facilities and a greater number of beds and rooms across the Grey County portfolio. As we started digging into it, we appreciated that the nurse call system was actually embedded within the Rockwood Terrace contract. It's not an owner element. So there are some elements of the new Rockwood Terrace which are owner supplied. We're doing them outside of the main construction contract. This is actually embedded within this construction contract, and so will be implemented through Malone Bloomie. And so we're left looking for systems to replace the systems at Grey Gables and Lee Manor. We reached out to the provider that we understand is being engaged at Rockwood Terrace to get a quote, and the quote came in significantly above our budgeted amount. In looking at why, there's multiple reasons why it's come in above our budgeted amount, but one of the principal reasons is this was embedded within the 10-year capital plan and hasn't been inflated over the 10 years. And so we really have a static cost which has seen significant inflation. We haven't actually inflated through the capital program. Jen, myself, and Marcus, as we went through budget 2026 and the initial budget conversations of 2027, and as we're starting to look at the new Rockwood Terrace coming on board, there is a body of work that is required in terms of looking at the capital plan and the asset management plan and the reserve financing to make sure the contributions going in are sufficient. And so this will be an opportunity for us to update that number on a go-forward basis, but does leave us with the acute issue just now of not having or having less money than we believe the new systems are going to cost. So the report in front of you today is asking for us to go out to RFP. Because we don't have enough budget and because we know that this is going to come in above the budget, we're seeking long-term care committee's support for going out to RFP and increasing the wiggle room that we have within the budget, so that when this comes in, it's not a massive surprise for us to be bringing back a very, very significant purchase over the estimated budget. So this is an early warning that we believe this is going to come in over budget. We're fairly confident it's going to come in over budget, and looking for committee support in how we might be able to go about financing that. We have looked at breaking the project up into 2 phases. We have looked at deferring this, making it part of a future budget estimate. The reality is these 2 systems are older. We would ideally like to have these systems at the same age as each other and the same age as Rockwood, so that in 10 years' time, when it comes to planning for the replacement of these, we can maximize that efficiency of scale and have the same technology platform across all 3 facilities and homes. So we have looked at a number of options, and at this point in time, it is the team's considered opinion that we should advance this procurement at this time through working with the capital envelope we have by deferring other projects that are in there. And so you'll see within the report that the proposal is that we defer some capital projects to free up capital space in 2026 to allow for the purchase of nurse call replacement systems. I would be happy to take any questions that might be, but as I say, Chair Mackey, the chances are I'm not going to be able to answer any detail on this one, and so we'll defer to my colleagues for some of the detail as needed. Thank you very much.
Thank you, Niall, for that report. I see Member Patterson has a question. Go ahead, Sue.
Thank you, Chair Mackey. Can someone explain what the effects would be on the air makeup system? Like, are we looking at higher costs on repair and maintenance or full breakdown or what? Please.
I see Marcus is going to take Niall off the hook, so go ahead, Marcus.
Yeah, absolutely. I've had the conversations with their maintenance supervisor of the dealing with the Lee Manor. The air makeup system, it is one that we're looking at deferral, and it'll be rescoped into the size of that project on the future 10-year capital. As to that, we've been doing a lot of preventative maintenance with this air makeup unit and replacing components as they start to wear or as they tear. And so currently how it's presented in that it's presented on the 10-year capital is for a full, as if you were to run it into the ground, it would break, you would then fully replace it. But because we are been doing preventative replacement and replacing components, there's no part in it that's of the same age. And so any future work or any parts and that kind of stuff, we're going to revisit it to look at, is there any very expensive part that we need to potentially budget for and to prepare for? But overall, they've been able to, in their current operating, been able to just keep doing it so that what was previously laid out in the BCA as the useful life and for a full replacement is not the case of what we're doing these days. And we've also had third-party confirmation with some of our contractors about that.
Okay. Thank you.
Other questions from committee members? Now, go ahead, please.
Whilst I'm not a committee member and don't have a question, because I'm going to be providing an answer to a question that nobody asked. So Councillor Patterson asked a good question about what the impact was on the air handling. The impact on the Grey Gables is we're doing a body of work, as committee knows, in terms of looking at Grey Gables. So at this point in time, deferring that work out is seen as being prudent until we have further clarity on what the future of that site might look like. And so again, no impact anticipated from that at this point.
The parking lot, is that both parking lots for Grey Highlands and the front parking lot? I'm seeing Jen nodding. Go ahead, Marcus or Jen?
Oh, we're going to fight over it. That's good. So through you, Mr. Chair, it was looking at maximizing and redesigning all of the parking on the whole Grey Gables property. There are a couple of areas that will need some remediation, but we believe, I think, and maybe this is where Marcus can weigh in, that we can manage those remedial bits in our operating budget. But there's no sense in redesigning to maximize the parking lot while this body of work is going on.
Agreed. Marcus?
No, that was exactly it. And now, so there is a few repairs that need to happen, i.e. that like we did generate from last year a small sinkhole. However, that's not this compassing of a capital project wasn't for that. It was for a full refacing, full additional parking. So that is again a rescope. You'll see parking lots on a future 10-year capital, however, at a much smaller scope size until we have the final decision for what's to happen with the space.
Okay, makes sense. Any final questions from committee members? All right, all in favor? All in favor? That is carried. Thank you. No closed meeting matters.
I think we're just missing, sorry, Chair. I think we're just missing the last report for E.
Sorry.
That's okay. That's all right.
You were absolutely right. LTCRCM 08-26 regarding single source of beds and whirlpool tubs at Grey Gables and Lee Manor be received, and that council supports the single source procurement of whirlpool tubs and beds for Grey Gables and Lee Manor from Weisner Boscherhoff. I probably wrecked that name, but anyways, can I have a mover to get that on the floor, please? Moved by Warden Matrosauce and second by Member Keaveney. And who's doing? Jen, you're doing that report?
Yes, thank you, Mr. Chair. And so the final, still exciting report for the meeting today, as you just described, is the single source procurement request. And so this too is a report that often comes to committee for us to be able to maintain our fleets and our products that with all of the same manufacturer. We do that across all three homes. We have a long-standing and excellent relationship with Arjo, which supplies our tubs and chairlifts, no, shower chairs, not chairlifts. I was thinking of the skiing discussion earlier. So our shower chairs. And we've done this with our procurement of beds as well. And so as the report says, we're looking to replace 3 Whirlpool tubs at Lee Manor and 3 Whirlpool tubs at Grey Gables, and would like to do that with Arjo so that we maintain the same equipment across all of the homes. With the beds, Rockwood Terrace received approval to single source their beds from Weisner Bosserhoff. I probably am not saying it right either, and I think from now on we'll just call them the beds. Based on the manufacturer's high quality bed furnishing solutions focused both on resident and caregiver safety. So they have a very nice home-like appearance, but have embedded safety features and comfort features that are really appealing to us and aligns with our vision and goals of the service we want to provide. Getting a little into the weeds, and perhaps at a tour, we can show you, we have a couple of those beds that we've trialed at the current Rockwood Terrace. And one of the features is that when the way the bed is constructed, when you use the bed for repositioning by raising the head or raising the feet, they do so separately so that the resident isn't sliding down or having shearing on the end, causing pain or discomfort on their bottom. And so that is something that is technology that team members and residents both really appreciated during the trial period. And it also has integrated fall safety. So when someone puts their feet out of bed, a light will come on to help illuminate the floor so that they can get their footing and see where they're going. And it also can also have embedded alerts that are linked with the nurse call system. So if someone has swung their feet out and the light comes on, but perhaps they require extra assistance, then there will be an alert that goes to the team members so that they can get to them and provide that extra support. The other thing I'll just note is, so the report is staff are recommending that in 2026, that Grey Gables and Lee Manor begin purchasing the Weisner Bosserhoff beds, with the caveat that in 2027, after the move, we will have really high quality beds that we're currently using at Rockwood that could come and replace beds at Lee Manor and Grey Gables. So we will have 2 fleets for a period of time through kind of a phased approach. And that helps us just maximize our fiscal responsibility. And we don't want to waste good beds that still have good quality of life. So, and we may be able to take a break then in 27 and possibly 28, depending on storage capacity, et cetera, for purchasing beds at Grey Gables and Lee Manor with the good beds that are available at existing Rockwood Terrace.
Thank you, Jen. Any questions for Jen? Go ahead, Sue.
Thank you, Chair. Just curious, Jen, do the beds, can they be lowered right to the floor?
I believe so. Thank you for that question through you, Mr. Chair. I see Karen nodding. So yes, they can be lowered right to the floor, and we'll still use, I don't know whether we have better words for them, but I think we call them fall mats, which maybe we should find better words. But they're a cushioned mat that goes on either side of the bed when it's lowered right on the floor. So if someone does find themselves falling out of bed, they're falling a very short distance onto a cushioned surface versus from high up. And with the Jorans beds that we currently use, we do have technology that we add to the bed that is an alert system. It's just not integrated and embedded in the bed the way the Wasserhof beds are.
Thank you.
Any other questions? Jen, how often do we replace beds? Like in our capital, is it a 10-year replacement, or roughly what's the lifespan of a good quality bed?
I believe it is 10 years. We have a robust inventory and audit process that includes the years of service the bed's been in place, but also includes assessments and audits around bed entrapment risk and mattress, the condition of the mattresses and bed surfaces. And so that's an ongoing audit process that the maintenance department, in partnership with nursing, does every year. So they're doing those audits monthly to make sure that every bed is being audited yearly. And then the lifespan is about 10 years. And we have this capital project as a recurring annual project so that we can always be staying ahead of it and not needing to buy 50 beds. We're buying a few beds and surfaces every year to maintain the quality.
Great, thank you. Not seeing any other questions. All in favor of receiving this report? That is carried. And I don't believe we have any closed meeting matters. No correspondence. Other than, I just wanted the annual report, Jen. We didn't really touch on that a lot, but it was a really good, really well done, and it was a good read. And I hope it gets broadly distributed because it really shows off our long-term care. So for everyone involved in preparing that report, thank you. It was a job well done.
Thank you, Mr. Chair. And there's a link available on the website if you're so inclined to look for it.
I like the paper copy, so I printed it off. Thanks. All right. Is there any other business? Not seeing any. Our next meeting is scheduled for Tuesday, May 19th at 10 a.m. And are we planning on getting together in person at any of the homes again, or will that be a virtual one again, Jen?
That's a good question, and we'll be back in touch on that.
All right. Thank you. All right. Well, if there's nothing else, thank you everyone for all the information today, and we will adjourn this meeting, or I guess I'll look for a motion to adjourn, moved by Member Carlton and seconded by Member Hutchinson. And all in favor? Thank you. We are adjourned at 11:02. Have a nice day, everyone.
Thank you very much. Have a good one.
Thank you.